You said that it takes about 18 minutes to complete the program. How many times a week do athletes have to do that?
We recommend 2 to 3. We definitely, in the beginning in particular, do not recommend doing it on game day because it is slightly intensive. We've had some feedback that it is a little bit labor intensive, especially when you're beginning it. Certainly later on in the season, it's easier to do when your body has become accustomed to the exercises. But in fact, a lot of the research that we've published, the average dose was about 2.2 sessions per week to be effective.
And is this program something that most athletes are doing as a team effort, or can they do it individually if their team hasn't adopted it?
Sure, that's the beauty of it because you can do it either way. I mean, we have encountered some reticence from some coaching staffs or strength and conditioning staffs. So if it's something that perhaps the player has had either an injury in the past that they're looking to prevent in the future, it's certainly something they can do on their own, or it can be very easily integrated as a team in a team setting as well.
You had mentioned before that the high-risk sports for ACL injuries are soccer, basketball, and volleyball. And I guess if you were to look at the PEP program, you'd probably say, those are the athletes who would probably benefit the most from it. But do you look at the program, too, and say, this should probably be part of any athlete's training because it helps to strengthen their core, their hips, their trunk, like you were describing?
Yeah, absolutely. In fact, we get calls all the time from rugby teams, lacrosse, field hockey, any sport that's played on a field or a court and demands land jumping, cutting, deceleration, pivoting, any sport that demands it, which are very many. So we recommend that all of those sports, you can easily integrate this program because only the agility portion of the program is sport-specific, but it can be very easily adopted by any sport played on a field or court. We just did a pilot a couple of years ago with a women's basketball program, Division I program here in Southern California. They were averaging 2 ACL injuries per season for this women's basketball team. And we spoke with the athletic director, and they were ready to replace the basketball court, thinking that perhaps it was a friction issue, the surface, a surface issue between their shoe and the playing surface. And we we changed our PEP program slightly and made it basketball specific, and we were able to reduce their injuries to 0, and in fact had a 62% reduction in all lower extremity injury. So we're really pleased about that. It's not only an ACL prevention program, we've seen a decrease in ankle sprains, hip injuries, and lumbar spine injuries as well.